The health workers at Fort Portal Regional Referral are still working round the clock as they treat survivors of a grisly road accident that happened on Wednesday. Diana Kusima, who was heading to Kampala, got onto the link bus in Fort Portal just before it left at around 9:30 a.m. She says just a few minutes into the journey, the bus fell. What had happened was the bus had hit the guardrails and overturned several times. She heard screams, bangs and wails as people inside the vessel cried for help.
I got to know that the bus was falling is when the bus fell on my side, but I didn't know how it fell and what really happened. Since the bus fell, till I reached the hospital, I was unconscious. I do not know how really I reached the hospital.
Yasin Ibrahim was sitting next to the driver. He remembers that the driver was speeding as they approached a corner and struggled to keep the bus on the road. He remembers hearing a loud noise and then the bus veered off the road into a tea plantation.
Into chakubye muludi gumutak kati chakubye na luzinga shi control kati ya basi kwe kubuka nekola shi negwa.
Kusima was sitting 3 seats behind the driver. Her friend who was traveling for her master's degree graduation ceremony also died. They had opted to use the safer option of the bus as they had feared that if they got an accident in a taxi, the chances of survival are low.
She had gone to the taxi park, then she came to the bus park. So we were judging on when accidents happen, when you're in a taxi, most of you lose your lives. But at least when you're in a bus, some of you are saved.
The mood at the hospital is somber. People are seen making phone calls outside the mortuary. Caskets are being ferried in empty and carried out with a body. By press time, the death toll had risen to 21.
On the ward, we admitted 31 patients. Then we referred two patients were referred. At night, we lost one patient. He was a man. He died in ICU.
The officer in charge of the casualty ward, Joyce Munakenya, said they do not have a CT scan to handle complicated cases.
When somebody needs a CT scan, we can't handle. We have to refer to a higher facility, higher level for specialized care.